stepped away from pushing a single payer, which we wanted, and we've embraced the public plan option. The public has embraced the public plan option, one that relies on Medicare, one in which rates are set and has a provider network, and that will cover people. And we can't, and you know, today I looked at the headlines, and the headlines are saying that that this negotiated agreement saves $100 billion. It actually costs that because it increases by 1% the cost to working people. Family of four making $80,000 a year will bear the cost of these increases. You know, Medicare rates negotiated upward. There's no way that doesn't increase the cost of the bill. I think when CBO comes back and scores that, they're going to say it's probably in the neighborhood of $75 billion. These are significant costs, and they shouldn't be borne by working people.
Congresswoman Edwards?
Thank you.
Mike Sorahan with the Hills.
Hi.
Is there,
You are?
Mike Sorahan with the Hills. Is leadership making any outreach that, you know, well, what, you know, since because of this deal, we'll, offer up other items? I mean, is there any sort of leadership offering anything to kind of heal the damage, I guess you might say?
You know, the thing is, there's nothing to be offered up. I mean, we've been very clear with the leadership and engaged with the leadership about defining a robust public plan option, and our definition of that hasn't changed. I know that some in our caucus has moved the goalposts many times. We've actually not moved those goalposts. We've embraced this public plan option. We've communicated that with the leadership. I believe that the leadership has actually heard us on this, and so now we're in another process. There are two committee bills that really have embraced the public option as we would envision a robust one, and I think that's to be worked out. And so at this stage, I think it is important for many of us, and those of us who signed on to this letter to the leadership, to say to them, our definition of a robust public plan option hasn't changed, and our support for what ultimately ends up on the floor of the House must include a robust public plan option.
Is it encouraging at all or helpful that the Speaker and they're starting kind of a messaging campaign that kind of goes after the insurance companies, kind of going on the offensive?
Look, the bad guy in all of this to me has always been the big insurance companies and the big pharmaceuticals. They are walking away with billions of dollars in profits and CEO salaries, in bonuses, and we're looking at a potential deal that actually transfers the wealth of the American people and the middle class to insurance companies. That's not acceptable. And so I think it's important to point out who the bad guy is in all of this. And it's the big insurance companies, and they will stop at nothing to try to kill reform. And we are saying to our leadership that we want reform, and we understand a pathway to get there, and we want to work with the leadership to make sure that in the end, the American people win and the insurance companies don't win. Not on this one.
Ms. Edwards, earlier in the week, Mr. Hoyer said he would be possibly open to a co-op. What's your problem with the co-op, and would you ever consider it if things got in a rut?
Well, co-ops haven't really worked in this country. I think that there were attempts to do co-ops, and there may be one left in the entire country. The difficulty, and one of the reasons that we thought it's important to link the Medicare provider network to the public plan is because these insurance companies and co-ops do not start out automatically with a provider network. And once you have doctors who are signed on to, one insurer or another insurer, they don't start out with a provider network. And so I think it would be very difficult, frankly, and probably very costly to pursue wholesale across the country this idea of co-ops. The public insurance option is one that will work. It is one that we understand. It's based on the Medicare infrastructure that already exists. The CBO says that it will save us $75 billion. There is no reason, and especially in our caucus, to walk away from a public insurance option based on the Medicare provider network that lowers costs.
But at the end of the day, if the public option was not there, would you consider a co-op if nothing else was available?
I think it's important to include a robust public plan option as I described it in the final bill.
Thank you.
Thanks.
Congresswoman, when you're talking to folks back home, what are the concerns you're hearing most about what's going on in Washington?
Well, I represent a district just outside of Washington, D.C., and many of the people in my congressional district, just like across the country, actually have health care. But they're afraid of increased premiums and deductibles and co-pays that are setting their out-of-pocket costs skyrocketing. And they want to make sure that we have a system that brings those costs down. And they're concerned about the people, even though they're not the majority of people in our district, who don't have health care and who deserve it. And so there are a broad range of concerns. I'm hearing from people that they're supportive of the public plan option. I actually come from a district where a lot of people embrace the single payer plan, as I did, but they are willing to embrace a public plan option if it's robust, if it's viable, if it will lower costs. And I believe that what we've outlined in the two committee bills in energy and labor and education and in ways and means embrace a public plan option that I think is supportable and sustainable. Listen, I got to run. Thank you.